My name is Chris Kennis. I got a couple different roles, but my primary role is program director for NeHII in Nebraska. So I've been involved from the beginning to help stand up the statewide HIE. I think most of you have probably heard of NeHII. It's been up and running for about 2 years now. It's really becoming the standard bearer on how to build a statewide HIE. As an example, we've kind of moved beyond how to get it and fund it and sustain it, and now we're moving into what else can it do for our providers? Can it do some of the other functionality activities? And so, with the good people of Ingenix and Axolotl, we've been able to implement NeHII. We're very excited about the progress we've been able to make. So, they told me to stay away from the speaker, so we'll have to see if this works. It works. So, what is NeHII? NeHII is one of the first statewide health information exchanges in the country. We went live in February of 2009 with our pilot. We went statewide in July of 2009. So we've crossed over the 2-year mark now. We're exchanging data. So I've got some stats on some other slides that are coming up. We're one of the largest HIEs in the country. We have about 19 hospitals now that are engaged in exchanging data. We're the first to come up with full functionality, e-prescribing, clinical messaging, physician referral, all of it came up live on day one. We are a completely virtual model. NeHII does not have a building, it does not have employees, everything is outsourced, which helps control the cost, keep the cost down, helps feed into that all-important sustainability model that many of you have been talking about in recent months. We're sponsored solely by the healthcare industry in Nebraska. And so the hospitals, the physicians, the health plans are those that own and run NeHII. We answer to them as on the board of directors. NeHII's population is about 1.8 million people. We have about 1.7 in the exchange already. 25% of those are from outside the state, though. So we have Southwest Iowa, we have Wyoming, Colorado, South Dakota, Kansas. They all send patients into Nebraska for care, and Nebraska sends patients across borders for care there, and that really emphasizes our collaboration with our surrounding states to try and get them engaged in NeHII and understand what they're doing as well. We have a little over 1,000 users now. That's growing daily. The 219 number is those that are using Axolotl's EMR Lite product. We have a little over 500 physicians using all types of products. We've been working with the Sages and the Greenways and the NextGens and the Allscripts to seamlessly bi-directionally interface between them and the HIE so that a physician does not have to leave their own resident system to get data out of the HIE. It's seamless integration. And we have about 17 million results in the system. Again, that grows about a million a month now. It will continue to grow as we continue to get more of our larger health system engaged with NeHII. Our total number of users, you'll see a couple of jumps in there. Every time we add a new health system, we get a jump in users. Creighton University Medical Center in Omaha is going to join here within the next couple of weeks, and so you'll see another big jump. Lincoln will join, you'll see another big jump out of it. So we're really getting a lot of activity within that. The number of consumers, again, the jumps are whenever we add a new facility. Specifically, the two big jumps is when we got outside the Omaha area, got to Hastings and North Platte. We're working very closely with Lincoln right now. If you're familiar with the geography of Nebraska, Omaha and Lincoln have a vast majority of the population within the state. Bring Lincoln in, you'll see another big jump in the number of people actually using the system. Number of e-prescriptions that are being run through the system. Again, we're getting a lot of that interest from physicians looking to meet the Medicare reimbursements. So a physician that wants to do e-prescribing through the exchange, total cost for them is $10 a month. So it's very affordable for them, easily to get ROI with the Medicare reimbursements. Our business model is very simple. We're a non-profit organization. We're 501c3 tax exempt. We are owned by the NeHII Collaborative, the healthcare industry. So the hospitals, the health plans have purchased Class B shares of NeHII. We use those Class B, the funding from that Class B to fund our startup. And in return for funding our startup, they give votes to elect members to the board of directors. So then the board of directors runs NeHII on a day-to-day basis. They're who we answer to when we have questions or concerns, or when we just need day-to-day operational experience. The board of directors, our governance structures, we have 16 Class B members. Those are those that are paid those Class B fees. We have 2 Class A members. Those are physicians or members of the general public. Those are just $100 a year to become a Class A member and then elect a member to the Class A board. So very affordable for the physicians and the consumer side of things. And then we have 4 appointed directors. One of them is the Lieutenant Governor of the state, another one's a consumer advocate, another one is representative of our professional associations within the state. So very diverse board of directors, stakeholders that are meant to really have everybody providing input into how the exchange is run on a day-to-day basis. The best part of this story is they all work so well together. Payers, health plans, hospitals, all of them are on the board of directors. Our board meets once a month by conference call, and it only takes an hour to get through all the business that we need to on the board. So very good group of stakeholders that work together for the purpose of getting the data in the hands of the patient. Our operations are funded through license fees that we charge physicians and hospitals. A physician that joins NeHII and buys the entire suite of products will only pay $52 a month to have access to the EMR line, to the virtual health record, to e-prescribing. So we keep it very affordable on the physician side of things because the physicians then in turn help us encourage hospital participation, encourage laboratory participation, and so they're the face of the patient, so we keep it very affordable for them. We have a sliding scale by hospital based on bed size. But as I'll tell you here in a little bit, we're going to move away from that license model to other sustainable revenues, such as clearinghouse functionality, such as patient portal type activities to help us fund the exchange without having to charge a monthly license fee or participant. Just briefly, I guess I'll hit on this slide too. The pilot phase I mentioned already. Our website is NeHII.org, and I've kind of touched on most of those except for the statewide integrator. When the ONC came out with the federal stimulus funds and said every state can have this much money to build a statewide HIE, they came to Nebraska and said we need to build an operational plan, we need to buy and build a strategic plan, which some of you probably know about. The difference was Nebraska was already built, Nebraska was already operational. So we had to re-engineer our strategic and operational plans to fit the ONC's mandates, which we did thanks to a good partnership with the ONC. But we are not the state-designated entity, you see, and that's a result of that conversation. The state of Nebraska is the state-designated entity. They're receiving the funds from the stimulus fund, but they have designated that NeHII is the statewide HIE, so a good portion of those stimulus funds are coming to NeHII. Because NeHII was operational, we didn't need the stimulus funds to build an exchange. So instead, we took that and we put it into functionality for the physicians and the patients. So we looked at CPOE, we looked at image sharing, we looked at claims clearinghouse, we looked at patient portals, we looked at the NeHII portal, and we're still doing all that functionality with our stimulus funds. And so that additional functionality will help drive physician and hospital participation within NeHII. So kind of a different example than you may have heard within your own states as far as the implementation of the stimulus funding within building an HIE. By the way, I love questions. I'd rather stand up here and ask questions than talk, so interrupt me with any questions at all. I don't mind at all. Our current participant list, as you see Creighton University on there, is really kind of the next phase. We've also working very hard on the Lincoln hospitals. There's one hospital in Lincoln, Bryan LGH, that we're in contract negotiations with. They have 40 critical access hospitals that refer into that one hospital. We have 99 hospitals in the entire state. So if we get that one left, we'll have the entire state, every hospital in Nebraska kind of closed into the just a few additional measures. I'm not going to go through these because there's like 5 slides of these. I don't know how they got in there. I didn't go into the presentation. Basically, you see how the number of users has, the relation has worked with the number of patients has increased over time. We've had a very good growth of those over the course of the year. Our opt-out rate, we are an opt-out state. We are a global opt-out state. You must either opt out of the exchange or nothing. You can't say, well, I want Methodist to see my data but not Allegiant. You can't say I want Dr. Smith to see it but not this. The only caveat to that is when we get into protected health information such as behavioral health functions, substance abuse, child abuse, HIV testing, those things are excluded at the point of care. NeHII doesn't exclude them, the hospitals and our participants do per contract. But other than that, you're either all in or all out. Even with that caveat that you're all in or all out, we only have an opt-out rate of about 2.7%. So less than 3 people per 100 will opt out of the exchange. So very successful, very accepted by the patient community within the state. My favorite statistic, just going back, what is that last line, the number of patients opted back in. We have had a number of patients, almost to the tune of 6% of those that opted out, call us back and say, you know, I've done my own research, I've gone to your website, I've talked to my physician, this is actually a good thing, can you opt me back in? I love that stat more than I love any of the other ones. It shows that consumers are really engaged in this and really wanting this to work in their health. We track all this information on a weekly basis or a monthly basis. We show it to all of our participants. We show it to all of our potential participants. It helps guide engagement, guide people knowing that NeHII isn't just an Omaha thing. NeHII isn't just a health plan thing. NeHII is a global solution. So these stats help us do this. We've actually got a little red and black fact sheet that we print off every week. Other HIEs across the country are starting to adopt that same thing as a way to get communication out on how an HIE is supposed to be run. And just more stats here, number of hospitals, percentage of hospitals. We'll have, with the addition of the new hospitals that we have joined, we'll have about 50% of the beds in the state part of NeHII. So very good percentage. We are working with public health right now. We've got a 3-phase project with the immunization registry. Phase 1 is we're going to send them immunizations from our EMR product. Phase 2 is they're going to send us all their immunizations so we can display it to physicians. And then Phase 3 is we're going to send them from third parties. So we'll be fully integrated in one place to get all the vaccinations and immunizations for everybody in the state. We're also talking to the school nurses to get them access to virtual health record so that they can pull that up, working through some of the legal challenges since school nurses are not subject to HIPAA. We've got to get through some of that business associate agreements, but it's still a good use of the data to help speed the process through which patient care is attributed. So, I mentioned the e-prescriptions, still doing a lot of those. We are also working with the state of Nebraska. The state of Nebraska is one of 9 states across the country that does not have a prescription drug monitoring program. And so instead of spending $1 million and $100,000 a year to maintain one, they're looking to NeHII. And so we've testified in front of the legislature on a bill that would designate NeHII as a solution for that. Right now we can get all through Axelows and Genesis relationship with SureScripts. We can get information from over 190 PBMs. We're working with the pharmacists to get them access so they can manually enter or electronically enter self-pay prescriptions. That'll get us most of the way there to where we can get a physician to go in, query, get all medications that that patient's taking. The first question I get asked when I talk about this is, what about those that opt out? And that's what really drives the system, is it drives it down to the physicians. The physician is still going to be sitting across the table from the patient. The patient's going to be saying, I've got a bad back, I need this, I need that. The doctor's going to ask him, well, are you in NeHII? I need to see all your medications before I prescribe it. The doctor still has the choice. We have a pain management doctor in Lincoln right now as a sign on his front desk. So we participate in NeHII, we believe in NeHII. If you do not want your records shared on NeHII, we suggest you find another physician. Not something we ask them to do, not something I don't even know if I would condone it, but they're taking upon themselves to see the tool and the resource that an HIE is and taking that to make sure they have all the tools at their disposal to treat the patient. I mentioned a little bit of our governance model, really very straightforward, a collaborative, elects the board of directors manages the day-to-day exchange. We're doing a lot with privacy and security right now, including working with a number of states on cyber liability insurance, as well as self-assessments as to whether your practice conforms to all the requirements needed to meet HIPAA and other things. Make sure that NeHII has comfort in our physician clinics, in addition to just having comfort in NeHII itself, because they are going to be an extension of us. Our operational manual, our privacy and security policies, and our operational manual, those are shareable. We give those to states and HIEs for free. It's an open source license agreement, so as long as you tell us that if you change that operational manual, as long as you tell us, because we may want to incorporate the same changes, As long as you do that, we'll give it to you for free so you can use that to get your exchange started up faster and quicker. We've had over 17 states review our privacy and security policies. Some of them have implemented them. The best part about that is they've gone through the due diligence, so we know that they're pretty sound. And so we've got a lot of great partners across the country. Some of our success factors, Dr. Harris Frank was a practicing neurologist within the Omaha area. He was a real driver for this. He could bring in the medical societies, he could bring in the hospitals. Definitely needed if you're going to build an HIE. Are flexible. We have a very big committee structure. They all meet once a month. They give us instructions as far as physicians want this. We've had our privacy and security committee say we want two-factor authentication. We take that to our HIE advisory committee and our physicians say, yeah, but I'm not carrying a hard token. And so then we're able to negotiate back and forth to figure out what is the best way between the committees to implement a two-factor solution that is going to appease the health plans, the providers, and the hospitals all at the same time. Entrepreneurial approach, we're continuing to look at different ways to generate sustainable revenue for NeHII. It doesn't stop with license fees. You can charge a license fee to a hospital from now to the end of the world. That's not in itself sustainable. So we look at clearinghousing. We've negotiated with 5 different clearinghouses the ability to submit electronic claims through NeHII. They use their own portal. We facilitate integration with the portal, but they give us 20% of the revenue from those claims. So if you look at a hospital that's paying 25 cents a claim today, they're a NeHII participant. If NeHII charges them 24% a claim, they still get a value out of that, plus NeHII gets 20% of the revenue on top of that. So eventually with these type of ideas, we're going to be able to move away from the license model and move more towards a more self-sustaining model. Pilot study. The pilot was important because, like most states that get into talking about NeHII or talking about HIE, we've got organizations that say, wait, maybe, let's talk about it, let's do a feasibility study, let's do an RFP. Doing the pilot study gets everybody up and running quicker, gets them going, shows value as we move forward. Accountability for milestones, obviously, from my project management background, I like to keep people accountable. Site visits, we're still doing site visits. If anybody wants to see NeHII working, come on up to Omaha. We've got the whole dog and pony show ready to show you everything from the CIO all the way down to my help desk person that answers the phone. So, what does it all mean for the healthcare? Obviously, faster, better, cheaper access to data. Our mission and vision has not changed in 5 years. We want to have the information at the point of care so the caregivers can use that in treating their patients. That is the focus of NeHII. It always has been the focus of NeHII. We're seeing, because we're robust, because we've been operational for 2 years, because we've got that entrepreneurship approach, we're able to take HIE to another level. Looking at the clearinghouse functionality, looking at the ACOs, looking at the patient-centered medical home, all these buzzwords that everybody's been hearing, we're looking at ways to incorporate them in NeHII. We're looking at ways to use NeHII to deliver CCDs to patients without having to manage their usernames and passwords. We're looking at ways to incorporate lockbox and functionality, looking at ways to engage Medicaid. So a lot of different activities that we're looking at just to further define NeHII and HIE within the state of Nebraska. So you can read some of those. I think I'm running out of time, so I'm going to kind of skip through those and just answer questions. I don't know, how much time do I got left?
Oh, let's see, maybe like 3 or 4 minutes.
I did talk too long. All right.
You did, it was perfect.
That was the last slide, so I'm going to just open up the questions before this thing explodes.
Actually,
Yes. The question was about fees and whether we do the transaction or not. We do not change the
we got them
transaction.
in the shop. I don't have any on
We
me.
thought
Sorry.
at the very beginning the transaction fees we thought would be a dissatisfier. Physicians would not want to use it because they know every time they click the button they have to pay an amount. It's just a license fee. Yep. It is enough to sustain a business model. So we've got a few hospitals left that are right at the board, but once we get that, we will have more revenue coming in. We have expenses going out. So then we're going to look at cutting the fees for the physicians first, moving towards the clearinghouse fees and some of these other transactional fees that we're going to increase. Yep, absolutely.
Any other questions? tapping in. And a reminder that at 5 o'clock, we will hold our drawing for that Apple TV Digital Media Extender. All of you who placed into the drawing for attending the presentation, you must be present to win. Call your name. You must be here. 5 o'clock, okay? We'll see you back.
Thank you.